I would suspect if not one of the issues, if not the biggest issue concerning the hospital association's Medicaid expansion, correct?
That's correct.
Where is the MHA at on this issue going into the 25 legislative session?
Well, look, MHA has supported policies that benefit Mississippians and access to health care for Mississippians now for almost 100 years. And so for us, Medicaid expansion still is a huge issue for our citizens and our patients to be able to get the best care that they need and be able to access that care in a more preventive way. And what we know about Medicaid expansion and the population that it would benefit is about 2/3 of those people are already working. And so the conference report that was filed last year by the House and the Senate is a great starting point, I think, to restart these conversations on expansion. It has a work requirement in there. With the election this past week, we know that a work requirement very well may be successful in passing CMS and federal scrutiny. So we think the conference report from last year is a great place to start, and we're looking forward to working with our legislators to see where we can go from there.
Break this down for folks who have not, they just kind of are on the periphery of it, but they're not on they don't know the nitty gritty of all of this.
Sure.
Why do hospitals believe they need Medicaid to be expanded in Mississippi?
Well, and it's not just hospitals, it's all the healthcare providers, the physician groups, and all the other providers want to make sure that their patients have the best opportunity for the healthiest life that they can lead. And so when you're healthy, you're able to work. You're able to do things for your family and it improves your quality of life. So it's beyond just a simple health care equation, but for hospitals, what we've seen in Mississippi is roughly 10% of the patients that come to Mississippi hospitals have no form of insurance coverage, which means they don't have the ability to pay, and typically that means they're coming to us at the end of a bad healthcare outcome or a bad healthcare journey where they're coming to the emergency department instead of being able to go upstream in healthcare and get clinical care, go to the pharmacy and get their drugs paid for. And so what we want to do is allow Mississippians to be as healthy as they can be, to have the best quality of life that they can have. And for the hospital standpoint, it's about providing that care in the most effective and efficient way. And at the end of the day, also, when we do have to provide care in an emergency department setting, being compensated for that care.
Really, this is a financial thing, is it not? I mean, because if these folks are showing up, they don't have insurance. If at least with Medicaid expansion, the hospitals are at least getting some payment for these services for folks who can't pay, right?
That's right. It is a financial implication for the hospital, but that financial void that would be filled by a payment source for these individuals helps cover all of us who may also have health insurance. Because right now what we're struggling to do, and have for years struggled to do, is to be able to find all the revenue sources that cover all the services that hospitals are required to provide. And under federal law, the emergency department regulations under federal law require hospitals to treat every patient in the emergency department setting regardless of ability to pay. That increases the cost of care for everyone when you've got a good percentage of your population that has no payer source. It just makes it more expensive for everybody. So that's just another reason. So it does financially benefit hospitals, but it honestly benefits everyone.
What are you hearing from legislative leaders? I'm assuming you've had conversations with the House Speaker and the Lieutenant Governor. What are they telling you as far as what to expect in this upcoming session?
So I think from a Medicaid expansion standpoint, leadership in both the House and the Senate are still interested in this issue. They still want to have the debate. They still want to talk about it. They realize it is probably the single most important thing we can do for Mississippi in healthcare, but not just in healthcare, from an economic development standpoint too, because of the additional revenue that it brings to the state that turns over as a multiplier across the economy. And so from a workforce issue, from a healthcare issue, and from a quality of life issue, folks understand what this can mean for Mississippians. So there is still a lot of interest in getting this done.
Have they given you any sense as to whether the members might be more favorable to it this time around versus what it was this year?
I think the more legislators are educated on the issue and the more they find out about the impact in their local communities, the more inclined they are to support this issue. Obviously, you're going to have some legislators, for various reasons, that aren't going to get behind a proposal like this. And for a variety of reasons. Maybe it's a financial concern, maybe it's a philosophical concern. But the more legislators hear about the impact and the real life examples of folks that are working in Mississippians that have a cancer diagnosis, that are putting a roof on a house and they fall off and then they can't go back to work. Or maybe they're seasonal workers that work on farms and in agriculture. When they're sick, they can't show up for work. That means something. It's the waitresses and the cashiers and folks that work in retail. It's the folks that work in construction that don't have access to health care coverage. And folks understand what that means to them from a health care standpoint, and legislators hear that from their communities, and that helps move the issue forward.
And it's not just the legislature, it's also the governor. And I have asked him this question off and on for years, and it seems like he's not budging at all. How do you get him to move, or do you get him to move, and all this is moved?
Well, we can control what we can control, and in healthcare we work with patients on what they need, and that message does not change. And so from MHA's perspective, we're going to continue to work on the issue, build consensus where we can. Under the Trump administration, the administration proposed something called a Healthy Adult Opportunity Waiver, which was really kind of the Trump administration's version of Medicaid expansion. It provided coverage for this category of eligibility for low-income working adults. It also put some guardrails around the expenses for the program and made the program basically kind of a fixed budget program, which I think can make a lot of sense if we do it in the right way. So I think there are very conservative, very Republican-led ways to accomplish this. We just need to keep the dialogue going.
And as we talk right now, what is the financial situation with Mississippi's hospitals? Because I know about this time during the 24 session, that was a big part of the conversation. Look, we got hospitals that are barely hanging on financially.
Right. And so, right now the Mississippi hospitals across the board are doing pretty well. And a lot of the credit for that goes to the program that Medicaid came out with back in the fall of 2023, which enhanced supplemental payment programs. Now, hospitals absorbed the state's share of that program by massive tax increases on the hospitals that funded the state share to draw down those massive federal dollars. But that has made a huge difference for the state. So we very much appreciate the governor's office and the Division of Medicaid for doing that. So that has very much helped stabilize hospitals across the state, where we don't find ourselves across the board in the dire shape we were in coming out of COVID. So that has made a big difference. The last remaining piece I would say that we need to put in place is this thing called Medicaid expansion, or whatever we want to call it. But it's a program that would provide access and provide health insurance coverage to low-income working Mississippians.